Hi everyone, it's Tim Ria here live with Keith Yamamoto, who's the Vice Chancellor of UCSF. How are you doing?
Very well, thanks. How are you?
So it's a brand new event. It's called Informed Health 2015. We're super excited to be here in San Francisco. Everybody in the world in healthcare is in San Francisco in the Bay Area. I know there's a couple other events happening like Health 2.0. We just got back from CES and I wanted to catch up with Keith. So what was happening inside?
Well, this is a great event because it begins to establish within the overall UCSF community the importance of digital health, of health informatics. We're in an era in biomedical research and in healthcare that is going to be increasingly dependent on big data and the analysis of big data. We've enjoyed a long run-up, maybe the last 30 years or so, of getting better and better at describing biological processes. But we need to take all that massive data and understand it. Doing that is really a computational exercise and one that is extremely challenging when you begin to think about the ethical matters, security, privacy, and so forth, and just being able to aggregate different kinds of information. So at UCSF, what we're doing is building out an endeavor called precision medicine, which really just says, what can we bring together data of all kinds about people, about patients and well people, about experimental organisms that we work on in our basic research laboratories, and use that to begin to make correlations between those bits of information and different data layers, so to speak. And in doing that, begin to understand better the mechanisms of disease, all the things that contribute to disease in an individual, that allows us to be precise about the diagnosis and treatment plan and therapy for you, not for you as a part of a big statistical group, but for you.
Personalized precision medicine, which is really interesting. What are some of the partners you brought together to make this happen?
Well, there's companies large and small. This is a health science campus, and so we don't have a computer science department. We don't have a chemistry department to make drugs and so forth. We have got very, very talented investigators and their trainees that are involved in those endeavors. But in no way would we presume that we could bring together all the tools that are needed when we're sitting right at the top of Silicon Valley and can have established friends there. And so without naming a bunch of companies, all I can tell you is that we are engaged in partnerships with big multinational corporations as well as startups that are just getting going with brilliant ideas. And it's a really stimulating environment and a great time.
It seems like a great place for students to come here. What types of students are you looking for?
Well, all kinds. I think that we have traditionally attracted among the best conventional biomedical trainees, people with biology training, molecular biology, cell biology, and so forth, that move into medicine. But now what's happening is that the fields are merging, and we're building programs and attracting students across the whole spectrum: engineering, computer science, mathematics, physics, chemistry. All of these areas can see where they can really not just contribute to the kinds of things the challenges that are in front of us, but really take over, really take ownership in ways that will allow us to move forward. So building that continuum across all of those disciplines is key.
Interesting, very interesting. So it's really changing the future of digital health. Where do you see this all going the next 3 to 5 years?
Well, increasingly, the collection of data, which is really at the heart of all of this, is going to come from wearable devices. This is just the beginning of that revolution, where data will be collected in the course of people's daily lives. It won't be going in to see a doctor.
It's like constant measuring versus just kind of like sampling.
That's right, and that constant measuring that you're talking about is really a key. It's what we call longitudinal testing, where you can look over time at a given individual and see what the changes are. And if you see that, then small changes become trends, and those trends, even though the slope may not be steep, tell you that something is happening. And being able to understand and detect and diagnose disease early is a key thing to really being able to cure it.
So that's all fascinating. Keith, any last things you want to end with?
Well, I think this is an exciting time. It's really great to see a room full of people in there that are really from kind of all walks of the biomedical research sphere and clinical sphere. And I think it's really the beginning of a revolutionary time in this field. So it should be very exciting.
It's fascinating. Well, thanks for having me down here, and it's nice to meet you in person. Cheers.
Great to meet you.